My name is Hallie Bonner, and I'm a master's student in the Child Studies program at Vanderbilt University in the Peabody College. Alongside the support of my mentor, Dr. Jessica Schwartzman at Vanderbilt University Medical Center, I have been exploring social camouflaging in autistic adolescents and associations with social processes and anxiety. Autistic adolescents social camouflage as a tactic to navigate challenges of the social world. In autism, social camouflaging is a compensatory behavior used to suppress autistic traits in social situations that are associated with certain social processes, such as the fear of negative evaluation and higher internalizing symptoms. The American Psychiatric Association describes challenges that autistic individuals face as trouble initiating and maintaining conversations, sharing interests or emotions, understanding relationships, and responding appropriately to social interactions. Social camouflaging is a risk factor for internalizing symptoms in autistic adults. However, there is limited evidence and research exploring social camouflaging and internalizing symptoms in autistic adolescents. What previous research has found is that internalizing symptoms like anxiety, depression, and stress are more prevalent among autistic adolescents in comparison to their non-autistic peers. Research has also found that anxiety disorders are 40% more prevalent in autistic adolescents compared to their non-autistic peers, while depressive disorders are 20.2% and 11%. From the data collected at VUMC, we have found that this can be explained partly by social camouflaging. There are three main goals of this study. The first aim was to examine associations between social camouflaging and demographics. We considered age, sex, and gender. The second aim was to test relationships between social camouflaging and internalizing symptoms. And the third aim was to explore whether social camouflaging adds unique variance to the prediction of internalizing symptoms in autistic adolescents. We developed three hypotheses. The first hypothesis was that social camouflaging will be positively associated with age and higher in adolescents with identities of female sex, cisgender female, and gender diverse. The second hypothesis was that social camouflaging will be positively associated with internalizing symptoms. And the third hypothesis is that social camouflaging will add unique variance to the prediction of internalizing symptoms even after accounting for demographic variables and autistic traits. A 105 adolescents with a clinical diagnosis of autism spectrum disorder participated in this study. The participants ranged in age from 11 to 17 years old. 63 were male and 42 were female. 60 identified as cisgender male. 28 identified as cisgender female. And 17 identified as gender diverse. De-identified clinical data was collected at intake in MBC AUT from the Youth Outpatient Services at Psychiatry Autism Research Team Clinic from January 2022 to March 2023. The following scales were used to measure social camouflaging, autistic traits, and internalizing symptoms. To measure social camouflaging, we used the social camouflaging subscale of Comprehensive Autistic Trait Inventory. To measure autistic traits, we used the Social Responsive Scale 2nd edition. To measure anxiety, we use the Revised Children's Anxiety and Depression Scale. To measure depressive symptoms, we also use the Revised Children's Anxiety and Depression Scale. We performed a series of non-parametric analyses to test our 3 hypotheses. Analyses for AIM-1 showed us that social camouflaging is positively associated with age and different between the sexes and gender groups. Specifically, autistic youth who were older and identified as female sex and gender diverse endorsed higher social camouflaging than their autistic peers. Analyses for AIM-2 revealed that social camouflaging was positively associated with anxiety and depressive symptoms, such that youth with higher camouflaging were also likely to endorse more severe anxiety and depressive symptoms, and vice versa. Autistic traits, however, were not associated with social camouflaging. Finally, analyses for AIM-3 showed that social camouflaging explains an additional 7% of variance in anxiety symptoms, even after controlling for demographic variables, autistic traits, and depression. However, social camouflaging did not emerge as a significant predictor of depressive symptoms. From the data collected, we found that social camouflaging is more common among older autistic adolescents of female sex and gender diverse identities. We also found that higher social camouflaging is linked with more severe anxiety and depressive symptoms. Finally, we found that social camouflaging may be particularly important in understanding and treating anxiety in autism, and less so in depression. Future research should investigate these constructs in larger samples of autistic adolescents and across developmental periods, such as the transition to adulthood. Social camouflaging may be particularly important to explore further in anxiety among autistic individuals. I would like to thank my mentor at VUMC, Dr. Jessica Schwartzman, for supporting this study. I would also like to thank my child studies advisors, Dr. Nina Martin and Dr. Vicki Harris. Funding has been provided by Vanderbilt Psychiatry Department and Vanderbilt Institute for Clinical and Translational Research. My contact information has been provided. Thank you for your time.